I've heard this many times from people. I don't want to beg. You're not begging when you're asking help. That's the thought process you're carrying, that asking help is begging. You need to change that mindset, that I'm seeking help because I need help here.
This is what osteoarthritis is all about. It's not going to take life. It's not a life-threatening condition, but it hampers the quality of life so much so that we've seen patients who just don't want to live anymore because the knees are so bad.
Welcome to Honestly Speaking with 360 Plus, your companion to holistic healing. I'm your host Anjana, and through this series, we're going to explore every aspect of osteoarthritis and how you can take charge of your joint health. At 360 Plus, we combine the wisdom of Ayurveda with the best of modern science to bring you expert-backed strategies to help you address root causes and heal from within. Today, we're looking at the connection and the association between mental health and osteoarthritis. Now, you wouldn't think that stress, depression, anxiety can exacerbate pain. So we have with us today Dr. Pooja Sharma, a leading emotional counselor and therapist, and Dr. Darshan Bafna, an orthopedic surgeon and knee and hip replacement specialist who is affiliated with the Phoenix Group, Lotus Group, and Criticare Asia. Thank you for taking the time to be here today.
Thank you for us.
So we're going to talk about the hidden ways in which stress and anxiety affect osteoarthritis and body pain. So Dr. Sharma, to begin with you, several studies have linked stress to an increased risk of osteoarthritis. So I wanted to understand a little bit about how stress impacts inflammation in the body. Could you talk about that?
So, see, stress is a very natural mechanism of the body to deal with any threat that body feels, any challenges body feels. And it is a very natural coping mechanism of a human body. Now, stress triggers response of fight or flight in the body. Once that happens, the chemical secretion in the body also gets impacted. Chemicals like cortisol, which are stress hormones, they get secreted once we feel the threat in the body. Now, with a condition of OA, a person who is dealing with it is going through the stress for various reasons, as we can look into the history of patients and we see how they progress in the degeneration of this disease. Once a person is under stress, the normal capacity of the body to heal itself is also compromised, and the level of chemicals which are secreted, which are harmful and detrimental for the progression of the disease, are also more, like the hormones which are in excess amount. So initially cortisol helps in inflammation reduction, but then as it becomes chronic, it causes more inflammation, which becomes more painful, the condition which a patient is going through. So I feel physical health and emotional health is not in isolation, they go hand in hand. Once you are focusing on the physical aspect of the condition, you also need to focus on the emotional aspect of it and how a person is going through the turmoil in the emotional well-being. And once if that can also be addressed from the beginning, it would be an easy journey for a person to deal with the problem.
It just helps the whole healing journey, I imagine. Yeah, Dr. Bafna, just on the same subject, when somebody is stressed, it affects the way you eat. It affects your eating patterns. It affects the way you sleep. It also would affect sort of definitely the way, whether you go to the gym or how regularly you exercise. What kind of impact can all of these sort of stress-induced habits have on joint health?
Well, a lot of it. For example, inactivity, the number one thing when a person is in chronic stress or any sort of a mental disorder, they will lose a lot of muscle strength. They'll lose a lot of stability in the joint, which the muscles provide, because of which there is additional stress on the joint, knee especially, because it takes the weight of the entire body. Secondly, your diet automatically becomes pro-inflammatory. It's a technical term, but in short, it would mean that a lot of chemicals like metalloproteinases, cytokines, all of them, they are increased in your body because of the diet you have. And like Dr. Sharma said, the cortisol initially will help, but over a period of time, the resistance to cortisol, that will again increase the damage to the cartilage. That is the number one thing in osteoarthritis, that your cartilage should not be damaged. Once it starts getting into the process of degeneration, so it is not possible to regenerate that.
Interesting. Now, you said that inactivity will lead to this. How quickly?
Quickly, it depends on multiple factors, but we've usually seen in around a year or two, once you start losing your muscle mass, disuse atrophy is something called when you don't use your muscles regularly, you don't train them in the right way, they definitely lead to a lot of joint instability.
So you're saying within a year, if I have a sedentary life,
Yeah.
sedentary means really sedentary, I've not hit the gym, I'm not going for my walks,
Correct.
you know, within a year, I can start to feel the impact of this.
Yeah. So osteoarthritis is basically divided into 4 grades. Most of us realize that there is something going on by grade 2. Grade 1 is usually asymptomatic. It's just more or less on and off knee pain, which anybody can have after a little bit of an exertion. But that progression from grade 2 to grade 3 happens in a year or two. If you are really sedentary, poor diet, poor lifestyle, and along with that, you add upon chronic stress, that just accelerates the whole process. It should have taken 5, 7, 8 years. It will come in around a year or two.
Okay. How, because you just mentioned it, how does the body's inflammatory response to chronic stress influence the progression of osteoarthritis?
Like I said, all those chemicals being released, all those medications that you're taking for your stress, for your depression, for your anxiety, all of them add up, and just make sure that the inflammatory state, so inflammation is basically a state of the body to maintain homeostasis.
Right.
And once your body is in pro-inflammatory state, everything degenerates quickly.
So I'm going to stop you for 1 second, because I just, when we say terms like homeostasis, we're talking to a regular audience, right? Lay people. Can we explain a little bit of that? And also, I just want to, when you said something very interesting just now, where you talked about the medication that people are taking for stress and anxiety, right? And how that plays a role. So if you can elaborate on those two aspects.
Correct. So homeostasis is basically body likes to be the way it is. Any change in the body, and it will try to resist. For example, stress is not a normal state of body. So whenever there is a pro-inflammatory or a stressful state, it'll try to resist it. And inflammation is one of the processes it uses, so that you can combat your things that are disturbing the homeostasis. So in that process, there is a lot of degeneration of the cartilage and many other things also. So the second question was, sorry?
About the medication.
Yeah. So long-term medications, for example, antidepressants, they are known to cause osteoporosis, that is weakening of your bone. That also leads to osteoarthritis in one way or the other. It's like a chain linked process, but eventually you will reach there.
Is that because they deplete the calcium resources in?
Can say that, yeah. In layman's term, yeah, can say calcium resources.
So if somebody, I'm just asking, if somebody is on sort of antidepressants, would it, obviously it'll differ case to case, and it cannot be overstated that always everything should be with the advice of a doctor. But would calcium supplements be something that you should take if you
Definitely. Calcium supplements, physical activity, not be compulsorily going to the gym or something. You can even do a normal walk for a half an hour or so, and you will be better off.
Right. Physical activity is so important for osteoarthritis, to prevent osteoarthritis and conditions like that, right? It's also so important for mental health.
I would want to add something here. Like he said, that it's a disease where your cartilage starts getting degraded. So for a person to understand what is the purpose of the cartilage in the bone joint, it helps in creating a protection, it helps in better mobility, it helps in giving the strength to the joints to move in whatever functionality they are in. So now when that starts getting degraded, we need to have certain external support to maintain that at a level where otherwise body would have done that. And once we ignore our own system and our own circumstances at that time, we will not be able to take the corrective measure at the right time. Once the degradation has happened to a level of no return, then it becomes very difficult. But if we are little mindful and acceptable to what situation we are in, we can look at positively going forward with recommended, like I said, physical activity, diet supplements and everything, which is required to at least put a plateau to degradation. It will be a slow progression. Progression will happen, but the progression can be halted. It can be delayed, but with right intervention of your own thought process and positive attitude in life.
very important subject. Thank you for bringing that up. Because doctors, do you have patients who come to you? You said that with osteoarthritis, we have you have grade 1, grade 2, grade 3, grade 4. So what stage do patients seek out assistance at? And at that point, when they come to you, can sort of holistic measures help to slow down the progression, as Dr. Sharma just
Yeah,
mentioned?
absolutely. So typically we have patients who tolerate a lot of pain. They can bear a lot of pain and, stretched going to a doctor for at least 2 to 3 years. By that time, the disease progresses from 2 to 3. And once you start seeing those changes, it becomes very, very difficult to manage without any intervention. But if they start coming earlier, if they start addressing the problem earlier, definitely holistic healing can slow down the process long enough that one might not need a surgery for life.
What stage should they come at? When should somebody think that, okay, now I need to go see a doctor?
Correct. So, very classical symptoms of osteoarthritis is difficulty in climbing stairs or going down the stairs, difficulty in walking, difficulty after you stand up for a very long time. Basically, whenever your knees bend and you straighten it up and put weight over it,
And it hurts.
it hurts. You should see a doctor. At least get the basic scans done to make sure that you're not missing anything.
So I also want to ask Dr. Bafna here, would it be helpful for patient to seek a proper consultation rather than banking on what advice Google doctor gives them in such times? Because most of the time you see your symptom, then you put it in a
Now it's
Google, that's why it
ChatGPT,
is
just
there. Yeah. So
no, it's always difficult. We are all inferior to Google doctors, so no challenge there. But yeah, it has misled a lot of people. A lot of them have come with a different complication, which we absolutely don't want to see for such a disease that we know about. So if it's something that we don't know about, everybody's researching,
Yes.
literature is there. But this is something that we know exactly every step of the disease. And if you seek out help earlier, we might be in a better position to help.
You know, it's
also a lot
very-
of diagnostics goes into figuring out what really is the problem. It's not just in isolation that, okay, my knees are hurting and that would be the outcome of it. Once you go to a proper doctor and take a consultation, you also get to know that, okay, along with other parameters, why it is, because this is not just one thing which leads to giving you a conclusive diagnostic.
Yeah, that actually helps me segue right into my next question, because what I wanted to ask you was that, people when they have certain mental health conditions like depression, like anxiety, the way they perceive pain can be different, right? They can be more sensitive perhaps to pain. So what would be so firstly, could it be that they feel that, oh, I have OA, then do I even want to seek help for it, or do I not want to seek help for it? Do they imagine they've got pains when they don't have pains? And also, what sort of strategies would you give somebody that, okay, say I know that I've got depression, I'm dealing with anxiety, and maybe people around me, my friends and family, know that this is a condition I have. So this, like, pain that should otherwise be manageable seems severe, So then sometimes you have people who say, okay, no, then, it's in your head, don't bother to go to a doctor and whatever. What should I do? What should be my indication that, okay, I tried this out, now I know I need to seek help? Or should you just not wait for that? Should you just, okay, my knees are aching, let me go to a doctor?
No, that's a very valid question, because most of the time when people come with such conditions, their first focus is, I can't do anything. What I was capable of, I'm not able to do that anymore, or I need to depend on people. So they start questioning their own self-worth. They start doubting and criticizing their own self. That leads to multiple behavioral changes in them: social isolation, not wanting to take help, irritability in their moods and everything. So when they come to us, the basic thing is, first accept what is your condition. This is new you. And now your environment is going to be different than what it was earlier. Start looking at it with a conducive way. Seeking help is not wrong, but don't take it as a weakness on your part that I have to take help, because that's going to make your life. I'll give you a small example. Suppose somebody who has OA can't open the jars easily. You keep ignoring that you are not able to open the jar, so it's going to be an everyday challenge for you to even do the basic needs of your life. Once you accept that, you will probably change it to
Find a-
turnable, or maybe something different which is easy to deal with.
Find something to
Yes.
sort of,
So
to make your life a little easier.
when you accept your condition, it is easy for you to take measures to find a solution to your condition. Now, coming to what you should do once you understand that, you should seek help and follow the process for a certain period of time to see the result. One consultation is not going to give you the outcome that you're looking at. You might come to a doctor and ask that, okay, what should I do? Doctor would suggest certain things. They might not be doable for you. Come back and say that I tried this didn't work out. There is another option, because approaches are not laid down. They are customized, they are very person specific, because they are individualistic approaches when you come for counseling or therapy to a therapist or a counselor. So give it a little time, try, and once you settle and you find a safe zone, it would be easy for you to sustain that for your journey forward, creating a better quality of life. So here emphasis should not be, when you're dealing with a doctor, look for pain management and also looking at making your lifestyle better with your current condition.
Yeah, I absolutely agree with
So
that.
for a simpler answer for that,
Yeah.
if your knees hurt, I usually tell them that take 10 days for yourself.
10 days.
Take some over-the-counter medications, 2-3 days, whatever you feel like. Do ice packs, all the home remedies that all the people at home suggest. If 10 days your knee is absolutely the same, or when you stop it's absolutely the same, please consult somebody.
If the pain lasts past 10 days,
yeah.
consult an expert.
I mean,
So
10 days is not a literature approved
yeah,
method,
but
but
just
it is
as a
for
rule of
everybody to
thumb.
understand.
Yeah.
Rule of thumb.
Yeah. So I wanted to ask you also, are there medical, so when you are, especially because we're talking about people who are dealing with stress, anxiety, mental health conditions, do you find that medical treatment complemented by sort of therapy helps?
Absolutely, it absolutely helps, because like we said, the whole plan of the treatment is to increase your duration from grade 2 to grade 3 or 4. You want to increase that, and if you incorporate therapy into it, it definitely helps. So, for example, we usually give physical therapy to the patients to adhere to that, to be compliant, to be willing to go to that physical therapist, do those exercises 2 or 3 times a day, religiously follow them. They need the help of a counselor, because as a surgeon, I cannot sit in the OPD and counsel everybody and let them know each and every aspect. For the patient to go from me to the counselor also is a big challenge. So for that compliance, for that adherence, it takes a lot of effort, teamwork, and that multidisciplinary approach is what we are looking at. In 2025 going ahead, this is what we are actually planning for.
So you've seen people who have got OA who are then reluctant to be treated, is that what you're saying?
Yeah, they are reluctant. They'll take medications at the most. They'll understand that there's pain and medicine will help me out. But to go to a counselor, to get themselves labeled as something, is again a stigmata. It's very difficult.
I can imagine that there would be a stigma. We were talking about this a little bit earlier and it was very interesting that you mentioned that there was this patient that you had who was rather young.
So young 38-year-old female. We corporate IT, sedentary lifestyle. So not much of a physical work, not really doing any diet or anything that helps her physically. But chronic knee pain, chronic is long standing, so more than 2 years or something like that. And she visited multiple doctors. All of them advised some scans, something, but she was actually quite reluctant. And
but she did the scans.
Later on, we tried and convinced her, and she got the scans done. Just saying that it might not be anything severe, but we realized she's already into grade 3 osteoarthritis at the age of 38 or something.
It's very young.
It's
and
very
she was
young.
not an athlete or had suffered an
Absolutely
injury.
no. Absolutely no. You don't need to be an athlete for osteoarthritis.
Yeah.
You don't need to be suffering from any injury.
But when it's that young,
Yeah.
are you seeing a lot of patients at that age with osteoarthritis?
So yeah, right now we are seeing them. But in her case, it was not the thing. The thing was that it was genetic. Her parents were suffering from it at quite an early age, so she developed it at even earlier age. But again, for that acceptance to come, that okay, I am suffering from a disease and it should have come to me, let's say at 58, but it's come at 38. So let me do something about it, let me tackle it in the way that they are saying. It's very difficult, and we lost to follow up, that there was no follow-up after that.
But so even though her parents had OA, she was reluctant because her parents must have been on treatment for it.
Absolutely.
And
They were
still
on treatment.
she was reluctant.
She was reluctant. She was reluctant, saying that there is no way I can get it at this age.
I suppose these are the things that you do come across, and so how does one handle it? How do you said that in this particular case that it was not even possible to bring her around.
Yeah, so I mean, adhering to physical therapy is number one. Getting all your medications right is definite key, and your diet and lifestyle, because more and more physical importance is given to more and more physical aspect of it. There are a lot of chemicals going on inside, and those reactions are never taken into consideration.
But I just also want to ask you. So, see, OA comes with pain. You're living with pain, so that means you're sort of popping painkillers to deal with it. If you're not dealing with it with whatever other course the doctor has prescribed, so you're just popping painkillers to live with it. You're not doing any physiotherapy. You're not doing anything else. What would be the repercussions of something like that? Because if this young woman was 35 or 38 and you're taking like heavy painkillers, your pain is going to keep progressing. You're going to keep raising that dosage.
Oh, it's going to damage a lot of other organs inside the body, and you absolutely don't want that.
So liver, kidney, everything.
Absolutely, absolutely. In our treatment protocols, it's usually not more than 10 days that we give you a painkiller or an anti-inflammatory, so to speak. But
Right.
The other lifestyle modifications have to start immediately.
So when you say lifestyle modifications, I'm just thinking a young woman who has a sedentary job, because you said IT industry, desk-based, whatever job. What can you do if your hours are long? And I mean, even I find it with work sometimes, it's just not, my whole life I've been so regular with exercise, but now with as work gets busier and busier, some days it's just not possible to get now. And for me, I have the habit of exercising. So if I don't in a week, I'll go out and make that effort and I'll find a way to get some exercise in. But a lot of people, if you've not even been used to it as a young person, you're not seeing it in your family, you said the parents were obese, then would you even force yourself that, okay, no, I need to go out and exercise, especially when you're feeling aches and pains? So what do you do?
Absolutely. That's the beauty of the physical therapy that we suggest. You don't need to go out and get special equipments. It's absolutely very simple. You wake up every morning, give 15 minutes of your time to yourself, and get all the targeted exercises done. So you don't need to be going to the gym, doing heavyweight exercises, none of that. You just
What
need
kind
to.
of exercises would one do? When you
So
say
basically,
that-
for the knee, the stabilizer muscles come from the thigh.
Right.
All of the thigh muscles have to be very strong.
Okay.
In particular, VMO is one group of muscle that helps your medial side of the knee, the inner side of the knee, to stabilize better. This is where the osteoarthritis hits the most.
I see.
So those exercises take hardly 15-20 minutes.
Really?
Yeah, absolutely. Once in the morning, once at night, and you see the change in 3 months. You will yourself feel that, yeah.
Would you be able to tell me one exercise? I mean, I know you're not a physiotherapist, but I'm just curious if you can.
Yeah, so you go to the gym regularly.
Yes.
You must be knowing quad extensions.
Yes.
This is a very, very similar exercise.
Okay.
But one is you go to the full range of motion.
Right.
That becomes painful.
Right.
Because you already have osteoarthritis.
Yes.
So what do? You just do it terminally. So the last 15 degrees of exercise comes into that physical therapy.
I
So
see.
you keep something, a roll towel or something beneath the knee,
Yes,
and try
to
to
support.
press it down so
Right.
that your static exercises are covered.
That's simple enough to do.
It's very, very
Can
simple.
be done at a desk as well.
Absolutely. Anywhere you find the time and place to do it, just do it.
So that's so interesting.
So
The
here's one thing also would be the change in the attitude, the change in the mindset. If the person feels that I'm helpless, I can't do anything, this little step also become very difficult. They would not even take the initiative to do that. But if they feel that, okay, let me figure out what can make me feel better in this situation, they will try to look at the smaller step rather than going full-fledged into the exercising and doing a routine which is regular. Starting small, starting with consistency and following it for a little while till the time you become comfortable with that, and then increasing it more. That would help in this situation. And for that, a positive mindset rather than feeling that I'm helpless to, I'm empowered to do at least this much. Looking at what is good here, where deterioration has happened, how can I arrest that? How do I not let it happen more? And what is better in my condition? Because there's always something, it's like seeing the silver lining. I see that and that motivates me to take the right corrective measures to do that. So what he's suggesting
It's very difficult
right
to
now.
see a silver lining here,
Yes.
actually.
I was
As
actually,
you're
actually
suffering
just going to
from-
ask you that exactly. That
Right.
so especially when now suppose somebody's had surgery, when we talk about seeing the silver lining, do you feel like it's hard for people when they've got stress, when they're suffering from depression, particularly, or anxiety, to see that silver lining. It's hard for regular people. It's hard for people with mental health, probably harder for
Absolutely.
them, right?
Very, very
So
difficult.
when they've gone through surgery, do you find that people who have mental health conditions like these take longer to recover?
They do take longer to recover, but they also need a lot of other things that usual people don't do. So for example, I personally like to call them for regular follow-ups. What that does is makes a 15-minute one-on-one interaction with the patient, and they go home with that little motivation, whatever I could give them, and carry on for a week or two, and then come back to me again with a little bit of more issue, and then again we can talk for 15
They
minutes.
find
So
a safe space with the
exactly,
doctor.
and they will find a very safe space because I've operated on them, so they have 100% trust. So whatever we tell them, please comply, they will absolutely do it. And usually we don't call the patients for 2 months. Follow-ups are 2 months, 6 months, something like that. But for them in particular, I like to, partly take up your part and do a little bit of counseling as much as we can do, because in my opinion, if you ask a 65-year-old lady who's undergone a knee replacement to go and see a counselor, she won't come to me ever again. She'll say that you are out of your mind. You don't know what you're talking about.
Yeah.
You're labeling me as somebody who has a
Yeah.
problem.
Yeah.
She would never come. She'd rather talk to me
Yeah.
without any issues. She'll tell
Yes.
me everything. This is a problem at home. These are the things that are going on. I'm not able to do everything, but they won't share anything of that out of that room.
So that's very interesting what Dr. Bapna said. For a little elder population, it becomes difficult, but that's more encouraging to see in the younger population where they want to, not be dependent on the medical medication for a long time. They want to get themselves weaned off, and then when they see that now they are stuck in this situation, they like to try alternative to get their health better physically and emotionally both. So I think that's what change I have seen in past recent years among the younger population. If they are facing such kind of physical inability in any way of their own lifestyle reasons, they are very forthcoming, though they don't want to be open about it, but in their own individual capacity, they don't mind coming for and seeking help. So I think that talks about their own confidence level to make their life better.
Yeah, you also talked earlier just now about positive mindset, about having a positive mindset and the impact of that. So do you find that people with a positive mindset, just like somebody who generally tends to be positive, tends to embrace, what needs to be done, as you said, accept it, and then deal with it better? Do you feel that that happens? And then what do you do to bring somebody around? So say somebody who's gone through surgery or who is maybe going to go in for surgery. Can meditation, strategies like that sort of help them, mindfulness, can that help them develop? Can you develop a positive mindset? Is that even
Of course,
possible?
see, it is also about using certain techniques which will help you better your mindset. So even if you're not coming with a positive mindset and you feel that your thoughts are so negative and draining you down, it causes physical exhaustion. It makes you keep feeling fatigue all the time. It doesn't allow you to have healthy habits or even sleep patterns that disturb. So once you start working on your mindset, and once it starts improving to positive thought process, you become more forthcoming to seeking help, not only from the counselor or therapist, but even among the peers, among your office people. Know your limitations, and then rather than taking it as your weakness, you start looking at it as a strength that, okay, this area I need help, this is my strength. So you are able to compartmentalize, you are able to put your own strengths in one corner and then look at where I need support and then start taking support there rather than overall looking at it as a very pitiable situation for yourself. So I feel when we talk about positive mindset, it's not just about how our thoughts are, it's about our confidence level, about our deservability. If I today have to seek help from you, I should feel that I deserve help. That is why I'm taking help.
That's so interesting to feel
Yeah.
that you deserve help. What a powerful thing that is.
I've heard this many times from people. I don't want to beg. You're not begging when you're asking help. That's the thought process you're carrying, that asking help is begging. You need to change that mindset, that I'm seeking help because I need help here. I will feel better in my current situation if I take help. When we work in the offices, don't we take help from different departments? We do very confidently because we feel that this is not my department. So similarly, we need to just accept the reality. This is what it is right now for me, and I need help to make it better. And that's about it. So change in mindset, I would not call it a negative or a positive. A shift in mindset will definitely help a person coping with their
What I'd like to ask here is that this change in mindset or coping with the chronic stress or getting some sort of, coming out of that mental state, how long would it usually take for a population who is predominantly prone for osteoarthritis, let's say around 55 to 65 years age, for them to come out of that? So, for example, I see somebody who's in grade 2, grade 3 OA, and I want them to come out of their chronic stress because of family issues, economical issues, n number of
Because you
things.
can't change
How
those
long
things,
would that take? Because that has a direct impact on my progression of osteoarthritis.
True, and the home environment is what it is. You can't change
Absolutely,
that. You
there
can't
are,
change the stressors. The
yeah,
stressors are there,
it's like
right?
unstoppable force and
Yeah.
immovable object. So how do you find any
So then
Right.
you look
midway
at the
between it?
symptoms to symptoms. So suppose if a person has come who's already suffering a lot, I would ask, okay, what is it that you want to better right now in your routine? Because it is impacting your life on a daily basis. So say suppose I can't sleep. Now, if that person is able to sleep comfortably for say 6 to 7 hours, that would allow the body to also do the self work to cope better with the disease. So it's not that I would ask that person, okay, forget about OA and forget about the medicine. Start one step at a time. I would start working maybe 1 or 2 therapies down the line, sleeping better, have the tools now to sleep comfortably. They'll come back after a week or two and say that I've been sleeping better for past week or so. Then go on to the next.
So usually it would take around 4 months, 6 months,
Yeah,
or
easily. And
earlier.
plus, it's see, while we do therapy work, it's not that you need to come to a therapist all the time. You learn certain basic tools. There are certain tapping exercises you learn. You learn certain ways of relaxation, visualization, relaxation, progressive relaxation of the muscles, which will ease out the tensions in the muscles and help you not feel the pain as much as you felt earlier. So, sensitivity to the pain is reduced. Your threshold to tolerate the pain increases, and that helps you having the faith in the therapy, and then you come back. So initially, as you asked, so the routine is once a week, and then as the time goes by, it's once in a fortnight, then once in a month, then move on to once in 3 months. And sometimes I've been living for 6 months wonderfully. I just came back from a hike and I had this problem, so I thought I'll ask you, what do I do? What do I do need to do
So
now?
4 to 6 months, I
That's a
think,
good
is
enough time for me as a surgeon looking at it. If I want to delay the surgery till a very good age to do it,
4 to 6
I would
months.
say 6 months is good enough time for me.
But so if I had to ask you, Dr. Bafna, one thing that, say, somebody watching our episode today recognizes that, okay, I've got knee pain, or I feel that, that this could be osteoarthritis, right? I mean, they may not feel that they could feel that it is arthritis. People don't know the distinction or what it is. But so you have some knee pain, right? What would be your advice to them today? The first thing was, of course, 10 days, try
Yeah,
all of
absolutely.
these remedies.
So
If it still lasts, then what?
in practical life, I mean, I don't know whether it's there in the literature. I've not really gone into it, but in practical life, I'd say first diagnose, get an accurate condition. You know what grade it is.
So go to a
What-
doctor.
Absolutely, go to a doctor, get it diagnosed first. You might not follow the treatment. You might go for a second opinion. You might go to a therapist, try Ayurveda, try acupuncture. There are 1,000 different kinds of things for pain relieving and all of those. First, get the picture clearer for yourself rather than walking in the dark. Throw some light over it and you know what path you're walking into, right? We don't do it, honestly speaking. So many patients, they just don't want to see that they have a disease, just want to see the other way around and life is going good. They want to completely ignore the problem. I would say embrace it rather than ignoring
Because it's
it.
not, I mean, it's not the end of the world. You have OA,
Absolutely
you can
not.
live with it.
It's
And
actually
prevention is
one
always
of-
better than cure. You
prevention
get to
is
know
better than
early
cure.
intervention.
But even if by the time they've come to a
Yeah,
doctor's
there are
grade 2,
great interventions that, right now we are at a stage where you get the surgery done today, you start working tomorrow and go home and, absolutely do whatever
That
you want
soon.
to. It's as early as that.
24 hours you
Yeah.
can. And generally, we didn't actually touch on this earlier, but generally in the Indian population, we would see, I mean, I keep talking about pain in the knee because my mom has dealt with that. So that's something that I'm familiar with. But it's fingers, it's what for osteoarthritis, what are the key markers? Where would the pain be?
So the fingers and all that's the other spectrum of disease. That's rheumatoid arthritis.
I see.
That's not osteoarthritis. So rheumatoid arthritis
Osteoarthritis would be mainly in the knee?
mainly in the knee, mainly in the weight bearing areas. It's the age related degenerating process which comes as you age and as you use the joint, in what ways you use the joint.
So knee, ankle? No?
It can happen at any part of the
Largely
joint.
for the Indian population?
Mostly it's the knee.
I see.
For the European population, it's the hip.
I see. So there is again, as you mentioned, even with your patient who's 35, there is a genetic component.
Absolutely. Genetic component, some old trauma, some old injury. Like you mentioned, she never had an injury. Or an athlete who has absolute overuse of the knee. That also leads to, they might have great muscles, but they've degenerated and used the joint so much that it's not possible to get them out of the osteoarthritis.
I would want to add here,
Yeah.
accumulation of your emotions in your physical body can also lead to
What is that?
situations like this. So whenever you are not able to vent out, we have a habit of disregarding. Okay, I'm upset, I disregard. I am not okay, I disregard. Or we are told by the society that
Yes.
everybody is going through this. What is the big deal that you're going through it? But we also need to understand that everybody has a threshold. What is okay for you might not be okay for me, and I need to understand that I might not do anything, but just accepting that fact, denial is not going to help me. Acceptance might make me look at opportunities and ways to deal with it in a better way.
So I just want to also ask you if there is one piece of advice, like I asked Dr. Bafna as well. Would you have one piece of advice that you would give somebody who has stress, depression, anxiety, some sort of mental health condition, and also OA? Today, what can I do today
I would
to get
say
better?
please trust whomsoever you're going to seek help. It could be a doctor, it could be a counselor, it could be a therapist. Trust and follow. Follow for a while and see the betterment in your condition, because it's very important to take expert advice. It doesn't come in isolation with just a result on a paper. You go do the blood test and one figure is risen, that doesn't mean that you have a chronic problem. Go seek the help of the people. MBBS takes years to happen. People are studying books and clearing the exams, and then only they're getting the knowledge to guide you. So ignorance can be a detrimental factor here. Non-acceptance can be a detrimental factor here, and unawareness is the biggest deterrent in you becoming better. So I feel more aware you are of your condition and ready to seek help and advice of the doctor. It will make your life better, and the coming years will be with a good quality. So don't live a quality life with your condition, and that's very possible, I think.
Yeah. So this is what osteoarthritis is all about. It's not going to take life. It's
Yeah.
not a life-threatening condition,
Correct.
but it hampers the quality of life so much so that we've seen patients who just don't want to live anymore because the knees are so
Really?
bad. Yeah, just last Dasera on
Can
the
the pain get that
particularly.
excruciating?
Yeah, and excruciating in the sense then you don't want to be doing the normal activities of life. For example, going down and having a walk in your own society, own garden nearby. You don't want to get out of the house. That will go on for 6 months, and you're getting boxed in, caged in so much. I mean, one of the patients, they might be listening to this also. At the day of Dasera last year, I saw her bedridden. She came from Goa. The son used to stay in Mumbai. And he just got him saying that she doesn't want to go out of the house. There's something wrong with it. And we saw the knee, great for osteoarthritis, full-blown disease, deformed knees, absolute bent legs. So we went ahead, did a high-risk surgery for both her knees. And once she started to walk, in 2 months, it took around 2 to 3 months. I was talking to you that they start walking in the next day. She started, but from being dependent to independent, it took her 3 months. And now she was around 67 or something. Now when she comes to me, there's always a smile on the face because she comes in walking. So it's to that extent. It won't take life,
Yeah.
but it will hamper the quality of
The
your life.
quality of your life.
This is a very
Absolutely.
important point, Dr. Bafna said, dependency. That's very, you feel very sorry about being dependent, especially if a person has lived a life where he's taken charge of his life all the time, or she's been independent all the time, and suddenly because of the illness, now you need to depend on people or seek help. It takes a toll on your own confidence level. It takes a toll on your own, you become very shaky about taking decisions in life, and you then stop taking decisions. You stop living life. You stop doing basic, which you would otherwise enjoy. So your life becomes very, very I would say boring, stagnated, you need to get back to look at new hobbies, look at new things that can give you joy. But that again happens with little effort from your end. I would say that there are tools available, there are options available. You all need to do, there's a buffet lying there, go and pick up your whatever is liking. It is different. You need to just say that this is different now.
But I think it's so interesting. We here at honestly speaking, with 360 plus is all about holistic healing, and it's just always so interesting to see that with stress, with things like stress and mental health conditions, and how that can sort of turn into physical manifestations, and likewise, right? I mean, so today's session is about how stress and mental health, when you're dealing with those conditions, and what is the link between those and osteoarthritis. But the converse is also true. So if you have osteoarthritis, it sort of can lead into depression and things like that as well. It's just so interesting to see how all of that comes
And
together.
I've seen a shift in the younger lot being more acceptable to their situations and wanting and willing to seek help. That is going to help them in the long run. And the irony is that those diseases which were earlier coming with old age only now are coming in the
Yeah,
younger
that's
years.
they are
So
for sure.
they are no longer old age problems, they are the problems of the current lifestyle. So I think more openness to accepting whatever you are going through is going to create more better options for you.
So we have a quick myth busting round now. It's not rapid fire. So if you feel you'd like to elaborate on a topic, please do. First one for you, Dr. Sharma. High stress levels can speed up the progression of OA. Is it true or false?
Yes. Stress can lead to multiple illnesses. OA is just one of it. So if you learn to manage your stress on a daily basis by any ways, it could be just cooking, it could be just gardening, it could be just taking a walk. Physical activity is required so that you let go of that stress that you have stored in your muscles.
Dancing, I would say.
Yeah, everything helps. Pick up a choice.
And Dr. Bafna, if the pain is in your head, right, then you shouldn't get a medical checkup. As in, what I'm trying to say is, like, sometimes, as I said, some people will be told by family members that the pain is in your head. But to them, their pain is very real. So should they seek help or should they not?
They should absolutely seek help. What I would actually frame it like, let the doctor say that you have the pain in the head rather than the family member saying it, because that's like giving an AK-47 to a layman and trying to shoot. It's not possible. Let the expert handle the thing that they can, and it's always you have a better chance. So medical science is not 2 + 2 is 4. There are always percentages. There are always chances that you take. So the chance of you getting better with the help of a doctor is a lot more than what with a family member or a quack or something like that, right?
Yes.
But the problem and the irony is that our population has a lot of more faith in those people rather than the doctors. So that shift, like she's repeatedly told, that it's coming in the younger generation because they're educated, literate, and all of those things. But still, it has to be more and more, created the awareness.
So rely on a doctor.
Absolutely.
I also want to add here, physical injury is visible, emotional injury is not visible. It's only felt. So go with your feeling, go with your understanding of your own self, and understand that you are in pain. And that's
Worst
okay.
case scenario, you go to the doctor and the doctor says you're fine. Right? What do you lose?
No, the doctor, if you go to a doctor would tell you that why, in spite of you physically being fine, you're not feeling fine.
Correct. So you learn something in any case
Yes.
about yourself.
Then they will tell you what is the approach that you need to follow. But if you sit at your own place and you don't see a physical injury and you feel that I'm perfectly fine, but I'm feeling it in my head, that will lead to some deterioration later on.
So Dr. Sharma, same question for you, slightly different though, but along the same lines. If someone says they have pain, especially a younger person, but he or she looks fine, then he or she must be fine and must be exaggerating.
Not necessarily. Not necessarily, because I would again say that it is her threshold to tolerate the pain. If she is finding that painful, she is finding that painful. If I have to go for a walk and I can't walk 1 kilometer and I'm finding it tiring, I'm finding it tiring. It might not be tiring for the rest of the population. So I need to look at why it is tiring for me at 1 kilometer. Because unless and until I don't go to the root cause, it will become maybe 500 meters tiring for me later.
And Dr. Bafna, joint pain is a normal part of aging. True or false?
It is true, but not doing something for it is going to worsen it, and worsen it really quick. So being mindful of that along with your aging and joint pain, yes, it's important. We don't give any false hopes that your joint pain is going to be absolutely zero with medications or physical therapy. But yes, you cope with it a lot better and your quality of life increases that much.
I see. Very interesting one for you now. Running on the treadmill, jogging on a hard surface, cracking knuckles, which I know there's one person in my team who does.
Yeah, that makes
Uh,
us too. Even I do that a
oh,
lot.
really?
Yeah, yeah.
But can that cause
It
osteoarthritis?
does cause osteoarthritis, but in very
Cracking your knuckles can cause osteoarthritis.
not very significant ways.
Yeah.
Anything that damages your joint. So cartilage
Mm.
is like silk. It's a very smooth material. Anything that damages it can cause osteoarthritis. Medically, cracking your knuckle is just releasing a nitrogen bubble. So it's not that that cracking is going to do something, but because of the terminal position that your knuckles get into, it might cause trouble later on.
It's also a habit, really. It's a
It is,
habit.
it is,
So,
yeah.
what can you do? I mean, if this is a habit, a very young member of my team, she knows who she is, who does this all the time. Her mom tells her not to do it, but she does.
So
this.
what is going on in the head at that time? Is it the
It's
nervousness
just a habit.
that
She's
makes you
sitting and
do?
reading something.
It's actually for me, when there's nothing going on in my mind,
Yeah.
that's the time I start
Yeah.
doing
No,
No,
fidgety
but if
stuff,
you have
something
to
like that.
analyze it even deeper, there is a pattern. You will notice a pattern that only in certain situation I end up doing that.
Really, we'll keep
That
an
is
eye
what
on that.
is diagnosed while you are talking with a person. That what leads to you doing that. Some people will coil their hair. Some people will bite their nails. So your body speaks volumes about what is going on in your head. So listening to your body is very important. It's not just a gesture.
Okay.
Your body is trying
Not
to tell
just
you
a
something.
gesture. Interesting. Dr. Sharma, people with chronic pain should really just stop thinking about it too much. True or false?
They start focusing only on the pain. Yes.
So they should stop thinking about it too much.
Too much,
They
yes,
can't.
I would say. Sorry to interrupt, but yeah, too much is the word that you're mentioning. That is absolutely correct. They should not be thinking about it too much.
Yeah.
They should think about it. They should get a picture and they should go on that part and then stop thinking about it.
Yeah. Don't keep sort of dwelling on the
Correct.
fact that I've got
Correct.
pain, I've got pain,
Correct.
I have OA, I have OA.
So accepting it, just I have pain. What do I do about it? Should be the approach rather than I have pain. I can't do anything.
Thank you so much. Thank you for your time. So what we saw today was that your mind and body are obviously deeply connected, as Dr. Sharma has said several times today. And managing stress is just as important as treating OA itself. For more expert insights on holistic healing, follow Honestly Speaking with 360 Plus. We are here to help you on your journey to better joint health and to take control of your health with informed choices. Share this with someone who would benefit from it, and let's take this first step together towards a pain-free life. Thank you.